All right, team. This is what we're going to discuss. I'm going to bring the boys back up after I introduce this particular news item. So, as of this week, as of yesterday, the ADA is investing in Pearl. Now, as you know, in full disclosure to this news segment, Pearl is a sponsor of this podcast. We have a great relationship with Pearl and the individuals who work there. So, this is not necessarily connected to them in any way. But I found this incredibly interesting that the ADA is now investing in Pearl. Now, they don't just invest in Pearl, they invest in Pearl and Overjet, two of the forefront AI companies that we're seeing in the dental space currently. Now, they're using their ADA reserves to invest in these two companies. Is that their endowment, their foundation, that they're using the money to invest? I don't know. Is that to level the playing field? Because they've actually been an investor in Overjet for quite some time and just bringing Pearl on recently. I've had a significant issue, if we're going on an editorial piece versus a news piece, I've had a significant issue with the ADA being an investor in Overjet for quite some time and having what seemed to be a very tight knit relationship with Overjet. So, is bringing Pearl on to level the playing field and to appear as though they have no biases towards particular artificial intelligence companies? I don't know. Does it make sense for a membership based organization to be invested in for profit companies in which they are currently writing the standards for? That's correct. So ADA has the standards committee that is working on artificial intelligence standards. Is it appropriate or a conflict if they are directly invested in the two major organizations that are providing the artificial intelligence to our dental profession? Now, look, I've had a long-standing issue with the investment in Overjet. So at least bringing Pearl into the playing field is advisable to level it out and say, look, we're playing with all parties. So I agree with that. But at the end of the day, as a dentist and a member dentist of the ADA, I have a slight issue with investing in for-profit companies when we should be setting standards for the profession based on science and evidence alone, not who's buttering our bread. And with that, that's the news. And now I have to bring on my guys to discuss.
I've got a question. How many of you would feel comfortable if the FDA was investing in Pfizer?
I would not.
I mean, this is the same point. So do I think it's a smart idea for an organization? I get it, not for profit, but that's okay. You can still use monies that are invested for great purposes in a nonprofit organization.
Sure.
That benefits,
don't disagree with that.
That absolutely benefits your organization as a whole. But can you invest within your own industry and then stay unbiased? You cannot. That is the classic conflict of interest.
Yeah.
And just in the way you wouldn't want your FDA or your CDC investing in the pharmaceutical companies that they are supposedly creating the standards for, we would not want our organization to. No, Chad, no, not yet. We don't want our organizations that are saying they are there to protect the public. No, that's not how it works. There is no way, if you have a vested interest in a company that you're invested in within your industry to do well, there is no way you can remain unbiased and be doing the bidding of public health. No way. So you know where I stand on this, Chad?
Counterpoint. Okay. You mentioned two organizations that I get your point 100%. But you've got the Food and Drug Administration and you've got the Centers for Disease Control. both government-run organizations. The American Dental Association is basically a lobbying organization that puts their stamp of approval on several devices and softwares, whatnot, devices and things, widgets per se, for the consumer and the practitioner. So I'm going to say that it is to level the playing field. Have either of you all read the white paper from the ADA in February of 22, I believe, based upon artificial intelligence in dentistry?
I have. Yeah.
I think it's very generic, and I think it's very good. Don't get me wrong, but I think if we really get to the meat and potatoes of that conversation, it's basically that dentists have to utilize the software as well as their clinical acumen to make the appropriate decisions, and that the software needs to be vetted, and the software needs to expose how their algorithms are created in order to come up with the artificial intelligence that is presented. And so with that being said, I'm not totally disagreeing with you, Jeff. I do have some beef with it, but I'm going to say that I think the ADA, if they're going to put their stamp of approval on various items and whatnot within dentistry, they need to understand all of them and they need to play fair game. But the question ensues as to where does it end? Because there's other artificial intelligence companies out there besides Pearl and Overjet and whatnot. The other thing is that we need to take into consideration.
Chad,
is
can
that
I interrupt you 1 second? I'm sorry. I don't mean, but
yes,
how do you? The thing is that once there is an investment in these companies, then how is the treatment and the view of these companies? There's already a built-in bias at this point. So any other companies come along, and now, maybe they challenge the science a little bit and say, look, I don't like the algorithms of these two other companies. And they come along and challenge it. But the ADA says, wait a minute, we got a lot of money invested here. I mean, human nature is human nature. You cannot say that that's not going to somehow bias the decisions on, who gets the blessing and who doesn't get the blessing. So I don't mind with them investing. I just want them to invest outside of dentistry, outside of the things that they are overseeing.
Who was the first to invest in terms of utilizing the product in the technology?
I don't understand the question.
I'm not going to say invest in the company, but who was the first to utilize the technology? And it's a very open and broad question, but the answer is the insurance companies.
Yeah, for sure.
So and the thing is that I don't think we really know how insurance companies are utilizing this data that they're receiving from AI. Are they utilizing it for us, or are they utilizing it against us? And I don't think any of us know the answer, because none of the three of us have sat behind the counter when an insurance claim comes in. Now, with that being said, I have to hope that the ADA is investing in artificial intelligence so that we can work better with insurance companies. I don't know the answer. I don't think any of us know the answer. And I would love to get Brett Kessler on here, because I'd like to find out the answer. Yeah. But if insurance, I've always said
this. Bash on the ADA, please. No. That's the thing is, I don't want to bash anyone. It's a legitimate
question.
Yeah. But it is
the purpose of a point counterpoint.
A concern. And So a couple of things. One, when the white paper was written in 2022, ADA was already invested in Overjet, and Overjet had a seat at the table during that white paper. So it already had a bias in that Overjet was actually actively participating in that process. So of course they wrote a white paper that validated the value of AI in a dental practice. So that in and of itself had an inherent bias. And I have someone who's sitting on the AI committee currently writing the standards for this and has not threatened, but offered his resignation multiple times because of that bias, because of the fact that it is not clear that Overjet is not persuading or manipulating the ADA standards. The same would be true. The ADA puts a stamp or seal of approval on a toothbrush or a toothpaste. Does that mean the ADA is invested in that particular company? So by you as the consumer buying something that has the ADA seal of approval, are you just patting the pocket of the ADA? You understand where that's going? So if the ADA is to be a scientifically reviewed and scientifically based organization, they should be investing in Tesla. They should be investing in rockets. They should be investing in crypto. They should be investing in
What about drones?
oil rigs in the Gulf of Mexico. Frankly,
Outside
I
of
don't
our
give an F
industry
what
that
they
they
invest
oversee.
in. It shouldn't have anything to do with teeth. And that's because if they're putting stamps and seals of approval on things that say, we believe that this is in the consumer's best interest, then the minute that they have an investment in that portfolio, you can no longer believe the value of the data. The data will always be persuaded. Take any company's data, like take any manufacturer's data. At least all of us in the dental space would say, yeah, that data looks great, but it also came from X manufacturer. So we have to at least appreciate that there potentially was an inherent bias in the scientific literature versus double-blinded, peer-reviewed study coming out of some ancillary basement in Yugoslavia, for instance, who has zero investment or biases in the manufacturer and the value of the data. They just want the information to be out and to be true. So that's my issue. And to your point, Chad, at least getting Pearl in the conversation means that what the ADA is recognizing is that they were disproportionately involved in an AI company. And now they are leveling the playing field. They're bringing Pearl into the conversation, which has needed to happen for several years now, because those are the two industry leaders currently in the dental space in AI. But I still argue, let's just hypothesize. And I love Pearl, but let's hypothesize for some unforeseen reason. Either a technology comes out and supersedes their capability, or we find that AI is somehow cancerous, or like something nefarious happens to patients by using AI. I don't know. Now, will we actually get legitimate information out of the ADA to remove their stamp of approval of AI and its involvement in the diagnostic process? Because now they stand to lose their entire reserve investment because they've put it into two AI companies. That's all I'm saying.